Okay. Well, hi, everybody. I'm Nina Crowley. I'm Seeka's Professional Affiliations and Education Manager, and I'm delighted to be talking today with Faith Anne Newsome, who is going to be one of the keynote speakers at an upcoming meeting, the Obesity Medicine Association in Anaheim, California. And so I snagged a little bit of her time so that we can talk about some of the stuff we're excited about for that meeting. And I thought she might be able to give us a little bit of a sneak peek about her talk, which is the last day of the meeting. So thanks, Faith Anne, for joining me. How are you doing?
Thank you for having me. It's very gloomy here, so my lighting's not the best, but I'm excited to talk about my first in-person conference and to chat a little bit more about everything we're going to be learning here in October.
Yeah. All right. So this is your first in-person conference ever since pandemic life or ever?
Before this, I only really went to the OAC, and I feel like that was, although the talks are very science and evidence-based, I do feel like a lot of the attendees are patients. So this is my first professional conference. I'm in my third year of grad school, and Obesity Week is usually the one that I frequent, but those have all been online. So it's my first in person.
That's a big way to go to the first conference with a keynote speaking role at a really solid scientific meeting like OMA. So, well, that is great. So I know I wanted maybe first to ask you a little bit about your story, but because your topic at the meeting is actually sharing your story, which I love so much as a fellow OAC Obesity Action Coalition board member and longtime attendee, I know we talk a lot about patient story and how important that is. And I feel so strongly that having the patient voice at a meeting should be a requirement. I've heard people say like nothing about us without us, and I really believe that. I mean, most of us went into our field in healthcare to help patients, and so it is sort of odd that we oftentimes have meetings, about the best care, but don't involve patients. So I'm super excited to see that that's being included at this meeting. And yeah, so if you want to maybe tell us a little bit about your story. I know you and I know each other pretty well from our North and South Carolina connection, but yeah, for our listeners.
Sure, I'll keep it brief because the majority of the talk is about my story. But I have lived with obesity for as long as I can remember. My mom knew that my weight was going to be something that I struggled with from the time that I was about a year old. So it's basically all that I've ever known. And so she would approach my healthcare providers when I was younger and received a lot of biased care. And then in my high school years, I was able to go to Duke Children's through Sarah Armstrong's program and ended up having bariatric surgery at 16. So from a personal perspective, that was really revolutionary in my obesity management journey. But professionally, it was too. So when I was going through that experience, I had a lot of questions about the complexities of obesity. And if everybody's telling me this is so simple, why am I having so many problems? Why are other families having so many problems? Why do they have whole programs in big hospitals like Duke that are dedicated to helping family with these issues? So my wheels really started turning, and I didn't know a lot about research. I'm from a really rural town in North Carolina, so research wasn't something I knew a whole lot about. There was just something in my brain that was like, you need to start doing research. So I went to UNC Chapel Hill research felt really accessible there. So I started working in a lab there, but that was an eating disorder lab. But I collaborated with Dr. Armstrong and that team through internships. And then started grad school at the University of Florida, where I'm in the Department of Health Outcomes and Biomedical Informatics, where I work in obesity research. And my passion kind of lies in exactly what my talk will be about, which is this intersection of the data and all the numbers that we look at as scientists, and then the patient stories behind them. So that's what I really try to do with my talk, is talk about the data, talk about what we know, but then give my experience as a way of what that looks like in real life for someone who's experiencing it.
Wow. Well, you said that so eloquently, and I think I've heard you talk about your story before. I think it's really powerful, and I think one of the areas that you and I have talked about a little bit is sort of that gap between, what are your options, right? So leading up to having surgery, even that bias that we all have to hearing you say, "I ended up having surgery," right? Like that's a language thing that we say that just comes so naturally. And I know one of the talks that we're both excited about for the OMA meeting is hearing a little bit more about where medications lie and kind of in that intersection of behavioral, nutritional treatment. I know these days it's really kind of refreshing to hear how much programs are becoming more collaborative. So it used to be these silos. You had surgery, you had medicine, and then, oh, maybe you had the dietitians over there. And so I think we're seeing a lot more interdisciplinary care and collaboration. But do you have any thoughts about sort of where that gap was for you and how that impacted maybe your decisions or your pathway?
Yeah, I think that in terms of behavioral and lifestyle interventions, we didn't really have access as a family to those evidence-based interventions that are available, I think, a lot more readily now. Or hopefully we're getting to a degree where they're more available now. So a lot of our efforts in terms of behavioral were self-directed. So it was my mom doing a lot of research online and trying to figure out where she could maybe intervene without that collaborative relationship, because the providers were just telling her to feed me healthy and eat less, move more was basically the advice that we were getting. And then I don't remember medication really being an option for us. I think that that's something that maybe we're entering into now, where I think we might see that a little bit more. But I don't remember it being an option for us. So it was kind of self-directed, and then we had to do the supervised treatment before they would do the bariatric surgery from an insurance requirement perspective. But I think it's important to remember, and this is one thing that I've learned growing up post-bariatric surgery, is at 16, I was a little naive and thought that I was going to have surgery and never have to worry about my weight again. But that continuum of care is important even after surgery. So the core tenets of behavioral and lifestyle interventions are things that I still have to work on every single day. And medications are even something that I've been interested in post-bariatric surgery, because my weight still fluctuates a lot. And obesity is something that I still am trying to manage as an adult, even after bariatric surgery. So knowing that there's a lot of options out there, I think, is important from the patient perspective too.
Absolutely. Well, and I think at this meeting, this is going to be a collection of the obesity medicine providers and the doctors who work in this field every day. And we know that in the past, couple years, we've seen so much more advancement coming through with medications and the GLP-1s. And so I'm excited that they're sort of proactively having this kind of a talk. There's a session that we talked about, the roundtable, that's going to be with some of our, people in the field that, do this every day. I think we're going to hear from them about kind of in a casual chat kind of a fashion about like how they're practicing and what they're doing. The collaboration between like the surgical society, the ASMBS, and then the OMA. It's nice to see that. So they're going to go through the 2018 pediatric and adolescent guidelines from the ASMBS with I believe it's a medical, a surgical, and a psychologist perspective. And so there's also, I found the Obesity Pillars journal, which is a new journal. The third edition that just came out last month has a roundtable discussion with those providers. So I think that would be a good sort of prereq, some reading for us to do before that session and kind of see what their perspectives are. And I think, hopefully they'll talk about, the future case and really where medications come into that as well. So it's interesting to think about that, because it is different, for adolescents and teens going through that transition care. I think the transitional period between when you're in a strictly adolescent program and then when you go to an adult program, that transition can be tricky. I know there's some talks about that from probably the medical perspective and the evidence perspective, but I don't know if you feel comfortable sharing any of your experience with sort of how that transition went.
Yeah, I think it's difficult because I had my care team when I was in high school, and that's when I had surgery. Then when I got to college, so reestablishing care there was difficult for me, and I don't know that I did it the best. And then moving to Florida, to a brand new state to start kind of my adult life, there's that transition of figuring out, where do I need to go? What do I need to do? What does my insurance cover? So I think that there's a lot of jargon and a lot of difficulty navigating those things if you don't know exactly where you need to go and what you need to do. So that has been a struggle for me from the patient perspective, is finding out, how do I maintain that care and who do I go talk to? And then there's also a fear of, is my provider going to be biased? Because you start with a team that you trust, especially in that adolescent bariatric center. I trusted all of them, and I knew that they weren't biased, and I felt comfortable in that environment. But I still have had healthcare interactions post-bariatric surgery that have been biased, and so that is something nerve-wracking when I'm starting new care with a new team. That you would hope, if they're working in a bariatric center, that they aren't biased, but it's still an ingrained fear when you've had that interaction, throughout your entire life. So.
Well, and you're someone who we know is highly educated in the language and the jargon about weight bias and about obesity care. I mean, this is your doctorate degree, right? So I don't think that that's going to be the experience necessarily of every patient. And so if you were struggling with how to find your home, how to find your people, how to maintain that you had adequate care through that transition, I can only imagine how hard it is for those who are a little bit less health literate, or who have limited access to care, or in rural areas. In South Carolina, where I live, there's really not much, between the 4 hours between two adolescent programs. So there's a lot to unpack there. So I'll be interested to hear a little bit more about that too, and if our healthcare providers have any programs or tips that we can implement more universally as well.
Right.
Well, I know we don't have too much time left, so I didn't know if you had any other parts of the meeting you're excited about. I'm excited to, really just get together with folks again. I know the April meeting in Atlanta for OMA was a really great meeting, and so I'm looking forward to this one as well in the fall. But and then you and I will probably see each other again at Obesity Week for the Obesity Society meeting, probably a week or two later in California again.
Yeah, I'm just excited as a grad student. It's so exciting to know that all these papers that I've been reading for the past 3 years, I'm going to be around the authors of them and hearing them talk. And in the online format, it's really hard to network and talk and have these kind of discussions like we're having now. I think they've tried to formulate it through chats and roundtables. So utilizing those is great, but I'm just really excited to be in person and learning and hearing all of the new information. So I'm excited for all the talks and to meet all these people that I've met online or through other conferences online the past few years. So I think it'll be great to be all together again with all this great information education.
Me too. All right. Well, and if we can sneak away to get to Disneyland, that might be a bonus. All right. Well, I'll see you in a couple weeks, not even 2-3 weeks, right?
Yeah, coming up fast.
All right. Well, thank you so much for previewing your story with us and just chatting with me. It definitely is getting me excited about all of this again, because I absolutely love the networking and connection at in-person meetings. So I will see you in California.
Yeah, thanks for having me.